jump from like one subject to another subject.
I don't understand.
Like the German thing, like
Yeah.
I know you gave us facts about it, but I don't know, like you just tell like how he like relates to your topic.
Okay, who doesn't enjoy a big fat juicy hamburger or an order of french fries or a chocolate shake? We all want to do that. We all want to run through fast food and get the foods that we enjoy and that we like. But the truth is that choices that we make today will affect our future as far as our health is concerned as we get older. I work in a doctor's office, as you know, and see a lot of patients, especially with type 2 diabetes and cholesterol issues. There are medications to counteract those problems, but along with that, you have a list of side effects. So you always have to weigh, do the side effects outweigh the benefit of that medication? If we would just make choices that were healthy choices to take care of the bodies that we have, we wouldn't even have to utilize medication necessarily. So today we're going to learn about how natural foods, how they not only prevent diseases, but they can actually cause our body to heal itself. What we take into our bodies has lifelong consequences and is something that we need to consider. I know we all have very busy lives and we spend most of our time in our vehicles, especially moms who have children. So it's just so much easier just to run through a drive-through. But what happens, especially with children, is they get used to eating those types of food, and then natural foods they don't enjoy. It's not sweet enough, it's not salty enough, and they don't want to eat those things. We all know that fruits, vegetables, and grains are essential to a healthy diet. But how much of that do we actually eat? How much natural food do we actually eat versus processed food and fast food that someone else has prepared? Even restaurant food is not as healthy as the food that you prepare in your own home. We're going to take a look at some foods that I would encourage you to eat. This is Heart Healthy Food. This is recommended from Lisa Turner from Heart Healthy Eating. We have granola and avocados, which avocados, as we know, can be high in calories. It's not about the calories. It's not about the fat that you're intaking. It's about, is it a natural food? Is it a healthy food? Will your body be able to digest and metabolize that food? Also, hummus is a good heart-healthy food. For cholesterol, if you eat beans and citrus and salmon, olive oil, and chicken, blueberries actually lower your cholesterol. So food can actually heal your body. Inflammation is another issue that a lot of people have. You hear a lot of it with fibromyalgia and arthritis. There are actually foods that you can eat to reduce the inflammation in your body. Two of those that I brought are cauliflower and bananas. Grab a banana versus driving through McDonald's. You know, there are ways to counteract and not put yourself in that position. Walnuts, eggs, potatoes, green tea, and spinach are also foods that reduce inflammation in your body. For diabetes, there's apples and dark chocolate, which everything in moderation, but dark chocolate does actually help to control type 2 diabetes. And almonds. 4,400 people a day are diagnosed with type 2 diabetes. Type 2 diabetes is not genetic. It's something that we actually have control over. So what that tells us is that there's power in the food that we eat, and we can take control of our bodies, and we can take control of our health. Eating healthy sounds, it's so common sense, you know, eat fruit, eat vegetables. We all know that. But I think if we actually kept a diary or kept track of what we actually put into our bodies, you might be surprised at how little natural food you actually eat. Reading labels is always something that my mom taught me growing up, is you read the back of the label. If you don't know how to pronounce it or you've never heard of it, it's probably something you shouldn't be eating. It's probably chemical-based, therefore not a natural food. In addition to healthy eating, routine screening is also something that is crucial to preventative medicine. According to American Accreditation Healthcare Commissions, these screenings are recommended. Cholesterol screenings are important, as we talked about, the foods to eat for cholesterol. By counteracting and controlling your cholesterol, that reduces your risk for stroke, heart disease, and blood clots, which is very common as you get older and up in age. Colonoscopies are recommended for everyone, male and female, at the age of 50 to diagnose early signs of cancer in the rectum and colon. It can also reveal inflamed tissues, abnormal growth, and ulcers, just to name a few. Also, mammograms are recommended for women. Mammograms do not prevent cancer, but when you can find cancer at an early stage, you have a more likely chance of being able to survive. Prostate exams for men identify cancers early also, and prostate cancer is very important to be able to find early in order to counteract that. Pap smears are also important for women as early as 21 years of age. At this time, earliest signs of cervical cancer is infection and abnormal cells. So in conclusion, I want to encourage you to start implementing some of these, not only foods, but just lifestyle changes for yourself. Proper eating, exercise, not smoking, not drinking excessively are all things that you can do to improve your life. We've all heard that growing old is not for sissies, so I encourage you to prepare yourself now. Prepare yourself to be healthy in old age, so that you can only not enjoy all the freedoms that comes with, but actually be healthy.